Ramon, you are one of the first worldwide who did place the Matrix implant. So how is your experience so far? How is it going?
Well, my experience is quite positive, I can say, because during the last years, I think we've been working in being more and more efficient and trying to do things more easily. And now with the Matrix connection, we can save the T-base. Is one step more into the digital where is in another step into a world of simplicity and not a more complex world.
What advantages do you see in the Matrix implant system?
Every time I connect a provisional and interim restoration or the final restoration, the prosthesis, I see that it's very, very easy to screw the crown into the implant, and very simple. It fits perfectly, and that's the biggest advantage for me, simplicity. And of course, the design of the implant is very clever, with a different tissue level concept, with a concavity in the emergence profile. But those advantages are minor ones. The biggest one for me is the connection, the smart design of the connection.
How individual patient-based healing colors can improve your daily workflow?
Yeah, I am a big fan of tissue level implants, and in the Matrix implants, I find two different designs, a narrower one and a wider one. In that way, I'm able to adapt the implant more easily to the final emergence profile of the prosthesis. And that is an advantage as well, in order to get the ideal aesthetic result without working so much with the emergence profile, like we did years before.
How would you describe the Matrix implant in one word?
Connection. Yeah, I think about the connection. It's a very clever one.
Yeah.
I remember the first I don't know where, last year, with talking with about the connection in Zurich, and but I didn't know that the connection was gonna be so smart. So I love the connection of this implant.
What is going to be your topic you're going to talk about on the 18th of June at our special event in Zurich?
I will speak about the evolution and innovation in immediate implants, because the way I practice immediate implants nowadays is quite different from a decade ago or 2 decades ago. I work much less and I get better results, and this is thanks to the digital workflow. And nowadays, with I can make it even simpler with this kind of implants, with this kind of connection, like a Matrix one.
Thank you very much for this interview.
My pleasure.